I bet you clicked on this video because you've been told you need to lower your cholesterol before your next visit, or your doctor's going to send in a prescription for a medication. Well, there's a way to drop your LDL by up to 30% without touching a single medication. Most people obsess over cutting out eggs while their iced coffee is loading them with 21 grams of saturated fat. And some take supplements that could land them in the hospital while ignoring the interventions with the strongest evidence behind them. So I'm going to change that by giving you the 9 strategies that are actually backed by science and exactly what to expect from each one. Stay until the end because I'm covering 2 supplements that are marketed for your cholesterol right now. And one of them sent over 500 people to the hospital in Japan. Most doctors have one goal when your LDL is high. Get the number down, but I have a different one. I'm Dr. Kabir Haricharan Singh, a physician who is board certified in both family and obesity medicine, and my goal isn't just a lower number on your lab report. It's reducing the lifetime damage that those particles do to your artery, because heart disease doesn't show up overnight. It builds slowly for decades before you ever feel a symptom. Before we get further into it, here's a quick disclaimer. Even though I'm a physician, I'm not your physician. This is educational information only, not personal medical advice. Always discuss decisions about your health with your own doctor before making any changes. Okay, let's get into it. Strategy number 1, dietary fat quality. Let's start with fat because the internet has turned this into one of the most confusing topics in nutrition. So forget what you've heard. Here are the actual numbers broken into 4 categories. And by the end, you will know exactly which ones are working against you. First, saturated fat, the one most people fixate on, and for good reason. It's in coconut oil, butter, fatty red meats, full-fat dairy, and most processed snacks. And it doesn't just raise your LDL, it raises ApoB particle count, which is the number that actually predicts whether you have a heart attack. Second, trans fat. This one used to be the villain. Now it's largely banned and mostly gone from the food supply. If you're already avoiding ultra-processed foods, this one's barely on your radar anymore. Third, monounsaturated fat, also called MUFAs like olive oil, avocados, almonds. Swap these in for saturated fat and your LDL holds steady or improves. This is the safe swap category. And fourth, the one most people have never optimized, polyunsaturated fats, also called PUFAs. Your omega-3s from fatty fish, walnuts, and flaxseed, and omega-6s from sunflower seeds and certain vegetable oils. Calorie for calorie, this swap gives you the biggest LDL drop of all 4 categories. Here's the part almost nobody tells you about. It's not what you cut out, it's what you replace it with that determines whether you actually benefit. And a landmark study in the American Journal of Clinical Nutrition proved this. Swap saturated fat for refined carbs, 0 cardiovascular benefit. Swap it for PUFAs, real measurable improvement. Here's what that looks like in real numbers. If you cut 100 calories of pure saturated fat, about what's in one glazed donut, and replace it with PUFAs, you can drop your LDL by 6.5 to 10.5 points. Swap it for MUFAs or whole food carbs, and you'll still see a benefit, just a smaller one. But swap it for ultra-processed foods like gummy bears, sugary drinks, refined crackers, and you get nothing. Same calories cut, just 0 benefit. Now here's where most people actually get tripped up, and it's not what you'd expect. Trap number 1, coconut oil. It's about 82% saturated fat. That's higher than butter, higher than lard, and yet it's been marketed for years as a health food. Multiple trials show it meaningfully raises LDL-C enough that the American Heart Association called it out by name in their presidential advisory. The fix is simple. Reach for extra virgin olive oil instead. Trap number 2, your coffee order. A large iced cappuccino from a major chain can pack up to 21 grams of saturated fat. That's the same saturated fat as 16 slices of bacon in one drink. People will cut their eggs, snack on walnuts, do everything right all morning, and undo it with a single coffee run in the afternoon. Strategy number 2, switch your coffee brewing method. This next one might be the single highest leverage change on this entire list. And it cost you nothing. No supplement, no medication, not even a different food, just how you brew your coffee. Here's why. Coffee naturally contains 2 compounds, cafestol and kawol. And those compounds block a receptor in your liver that's supposed to be regulating how your body handles bile acid. When the receptors get blocked, your LDL goes up. The fix, a paper filter. That's it. Cafe stall and Kawil get trapped in the paper, but French press, espresso, and unfiltered coffee let them go straight into your cup, while a basic paper filter blocks them almost entirely. And here's the number that makes this worth doing. A review of 6 randomized trials found that switching from unfiltered to paper-filtered coffee dropped LDL by an average of 15 points. 15 points from changing how you make your morning coffee. That's not a minor tweak. That's one of the most effortless wins on this entire list. Strategy number 3, dietary cholesterol and genetic variability. Dietary cholesterol, mostly from eggs, might be the most argued about topic in nutrition, but here's the actual answer, and it's more interesting than eggs are good or eggs are bad. Some people can eat eggs every single day with almost no effect on their cholesterol. Others eat the exact same amount of eggs and their LDL climbs. And right now, there's no good routine test that tells you which one you are. When cholesterol from food reaches your small intestine, the average person absorbs about 50% of it, but that number isn't fixed. Some people absorb up to 90%, while others almost none. That's called cholesterol hyperabsorption, and it's largely genetic. So what does this mean for you? In a randomized trial, the average person sees about a 5-point LDL increase per egg per day. That's modest. And if that egg is replacing something worse, like a pastry or sugary cereal, it might be neutral or even a net win. But if you're eating 3 or 4 eggs a day and your goal is to bring your LDL down meaningfully, it's worth testing a reduction, especially if you might be a hyperabsorber. Just don't make the swap I keep warning about. Don't trade eggs for ultra-processed food or anything higher in saturated fat, because that's the same trap from strategy number 1, just wearing a different disguise. Strategy number 4, soluble fiber. This might be the most underused tool in clinical nutrition for lowering LDL, and it's also the cheapest thing on this entire list. Here's the mechanism, and it's genuinely clever. Your liver pulls LDL out of your bloodstream and dumps it into your small intestines as bile. Normally, your body recycles about half of that bile. Well, soluble fiber breaks that cycle. When it hits water, it turns into a thick gel. Think about what happens when you drop chia seeds into liquid. That's the exact texture. That gel traps the bile acids and carries them out in your stool instead of letting them get reabsorbed. So your liver has to go pull more LDL out of your bloodstream to make and replace the bile. That's the whole mechanism. Fiber forces your liver to clear more cholesterol every single day. Now here's what that's actually worth. For every 1 gram of soluble fiber you add daily, you can expect about a 2-point drop in your LDL, and it adds up fast. Your best food sources are oats, barley, psyllium husk, legumes like lentils, black beans and chickpeas, plus chia seeds, flax seeds, apples, and Brussels sprouts. If you want to supplement psyllium husk, the active ingredient in Metamucil is the most well-studied. 1 tablespoon twice a day shows an average 13-point drop in LDL. That's 13 points from fiber alone. My recommendation, food first. Oats at breakfast, legumes at lunch, chia or flaxseed worked into meals. Then use psyllium to close the gap that you need if you're not getting 30 grams of total fiber a day. Strategy number 5, plant sterols and stanols. This one comes with a catch that almost no supplement company will tell you about. So stick with me to the end of this section. Plant sterols and stanols are compounds found in plant cell walls, and they do something clever. They compete with the cholesterol in your food for absorption in your gut, so less of it makes it into your bloodstream. The data here is consistent. 2 grams a day can drop your LDL by 5 to 10%, which is why most clinical guidelines still list them as a reasonable add-on to diet therapy. Here's the problem. Getting 2 grams from food alone is basically impossible. You'd need to eat about 30 avocados in 1 day, and we all know guac's extra. So realistically, you're looking at fortified foods, certain margarine, yogurts, and juices with sterols added in, or a dedicated supplement. But before you go and add this to your routine, here's the catch. A small subset of people are sterol hyperabsorbers. Instead of blocking cholesterol absorption, their bodies overabsorb the sterols themselves, and in that group, high doses may actually increase cardiovascular risk. That's the part you won't see on a label of a sterol supplement. So if you have a strong family history of premature coronary heart disease, talk to your physician before starting high-dose sterols. Strategy number 6, replace animal protein with plant protein. This one doesn't ask you to give up meat, it just asks you to swap it out a few times a week. And the data on what that does is honestly kind of stunning. One of the largest reviews ever done on dietary protein, 108 randomized trials, found that replacing animal protein with plant protein drops LDL by about 6 points on average. And here's why. Plant protein has 0 dietary cholesterol. It's naturally low in saturated fat, and it comes bundled with soluble fiber, plant sterols, and anti-inflammatory compounds, which means a single plant protein meal is stacking 3 of those strategies you've already learned all at once. Your best sources? Legumes like lentils, black beans, and edamame, plus nuts, seeds, and tofu. And to be clear, this isn't an all-or-nothing ask. Even 2 to 3 meals a week where plant protein replaces animal protein produces a real cumulative effect. Dr. David Jenkins at the University of Toronto combined plant protein, soluble fiber, plant sterols, and nuts into what's called the portfolio diet validated in JAMA, and it dropped LDL by approximately 30%, which is comparable to a low-dose statin from food alone. Strategy number 7, exercise. The real numbers. I need to push back on something here because you've probably heard 2 completely different things about exercise and cholesterol, and they're both a little off. For years, a lot of lipid specialists thought exercise barely touched LDL at all. The data was mixed and the effects seemed small, so it got dismissed. But a recent well-conducted meta-analysis finally clarified it. Aerobic exercise 4 times a week lowers LDL by about 5 to 6 points on its own. Now add resistance training, just 2 sessions a week on top of that, and the total climbs to about 11 points. And that's before counting everything else exercise does for your lipid panel. Better insulin sensitivity, lower triglycerides, higher HDL, lower blood pressure, and less systemic inflammation. All of it feeding into your overall cardiovascular risk. Not just one number on your lipid panel. Here's the ideal target, 150 to 180 minutes a week of zone 2 cardio. That's the pace where you can still hold a conversation plus 2 to 3 sessions of resistance training. Zone 2 specifically matters because it trains your mitochondria to burn fat more efficiently, and that directly improves insulin resistance, driving plaque formation at its root, a process called atherogenic dyslipidemia. But here's the real reason exercise is non-negotiable. Even if it never moved your LDL by a single point, your VO2 max, basically your aerobic fitness, is one of the single strongest predictors of all-cause mortality in all of medicine. Stronger than your cholesterol number itself. So, no, exercise isn't a magic fix for LDL, but it's not optional either. Strategy number 8, sustainable weight loss. This is the strategy I see misunderstood more than any other, and it's one on board certified specifically to treat. So let's get into it properly. Most people think of visceral fat, the fat around your abdominal organs, as just extra padding. It's not. It behaves like an active organ. It pumps out inflammatory signals, drives insulin resistance, pushes your liver to overproduce VLDL, and actively suppresses your HDL. That makes it one of the biggest upstream drivers of the exact problem we've spent this whole video talking about. So, what happens when you lose it? A meta-analysis in the American Journal of Clinical Nutrition tracked people who lost weight and kept it off for at least 12 months and found a clear dose-dependent drop in LDL, about 1.3 points for every kilogram lost. Lose 10 kilos and that's roughly 13 points of LDL reduction, and that's before you count any improvement in triglycerides, HDL, blood pressure, insulin sensitivity, and inflammation. Here's how to actually do it sustainably because crash dieting backfires. First, protein. Aim for 1.6 to 2. 2 grams per kilogram of body weight per day, which translates to about 0.5 to 0.75 grams per pound per day. That's the range that protects your muscle mass while you're in a calorie deficit. Second, resistance training. This is what keeps your metabolic rate from crashing as the weight comes off. And third, focus on whole foods to bring down caloric density instead of just restricting calories on the same processed diets. That's the difference between a plan you can sustain and one you'll abandon in 8 weeks. Strategy number 9, probiotics, honorable mention. Last one, and I want to be upfront. This isn't strong enough evidence to build a recommendation around. I'm including it anyway because early signals are generally interesting and it changed how I personally think about fermented foods. Here's what the early data shows. In randomized trials lasting 2 to 12 weeks, probiotic supplementation reduced LDL by about 8 points on average. But, and this matters, we don't yet know which bacterial strains drive that effect, what dose actually works, or which patients benefit the most. So here's where I land on it. I'm not telling you to go buy a probiotic supplement based on this. What the data does support is simpler and lower risk. Naturally fermented, probiotic-rich whole foods. Miso, kimchi, sauerkraut, kefir, live culture yogurt. Foods you'd want in your diet anyway. Now here's what I told you to stick around for. 2 supplements being marketed for cholesterol right now that I do not recommend. First, red yeast rice. Red yeast rice lowers LDL through the exact same mechanism as a statin drug because it contains monocolin K, which is chemically identical to the medication lovastatin. And to be clear, statins are some of the most studied, safest drugs in medical history when properly dosed and monitored. So the problem with red yeast rice isn't the mechanism. The mechanism works. The problem is what else is riding along with it. Red yeast rice contains a mycotoxin called citrinin, which damages your kidneys. And this isn't a find a better brand problem. Independent lab testing has found citrinin contamination across red yeast rice products, including ones labeled citrinin-free. In 2024, in Japan, over 500 people taking red yeast rice supplements were hospitalized, and up to 80 of them died of kidney failure. Second, green tea extract, specifically EGCG. Drinking green tea, genuinely fine, even modestly beneficial, but green tea extract supplements are a different product entirely. They contain catechins, especially EGCG, to doses you'd never get in a cup of tea. In the early 2000s, these showed up in diet pills with some modest LDL benefit. But high-dose EGCG has been documented to cause acute liver damage, sometimes severe enough to require a transplant, even at doses sitting right within the label's recommended range. So drink your green tea. Just don't take the concentrated extract for your cholesterol. Here, the risk outweighs the benefit. Now, here's the perspective I want to leave you with. Your LDL number isn't the goal. It never was. The goal is preventing the heart attack, preventing the stroke, adding years to your life and life to those years. The 9 strategies in this video work because they don't just chase a lab value. They improve your insulin sensitivity, lower inflammation, reduce visceral fat, and they improve the health of your blood vessels from the inside out. Even if your LDL doesn't drop as much as you would hope, every one of these is still lowering your real lifetime risk. If this video gave you something your last appointment didn't, and let's be honest, a 15-minute appointment doesn't have time for all of this, then subscribe and send this to someone you love. Give them the education, not just a diagnosis. Take care, and I'll see you in the next one.